limit fluid intake during meals. D. Instructing the patient to lie down immediately after eating. Answer B. Offering high-calorie, soft-textured foods. Rationale: patients with PD often experience dysphagia, which can lead to malnutrition and aspiration pneumonia. Offering high-calorie, soft-textured foods can help ensure adequate nutrition and reduce the risk of aspiration. A encourages eating quickly, which can increase the risk of aspiration. C could lead to dehydration and does not address the risk of aspiration. D increases the risk of aspiration pneumonia and is contraindicated. Question 2. During a home visit, a nurse observes a patient with Parkinson's disease shuffling and taking small steps. Which nursing diagnosis is most appropriate for this observation? A. Impaired verbal communication. B. Risk for falls. C. Ineffective airway clearance. D. Altered nutrition, less than body requirements. Answer B. Risk for falls. Rationale: Parkinson's disease affects movement, leading to a shuffling gait and bradykinesia, increasing the risk of falls. The other options, while potential concerns for PD patients, are not directly related to the observed shuffling and small steps. Question 3. A nurse is planning care for a patient with Parkinson's disease who exhibits bradykinesia. Which intervention should be included in the plan of care to address this symptom? A. Encourage the patient to participate in high-intensity aerobic exercises. B. Administer anti-Parkinson medication promptly on schedule. C. Restrict the patient's fluid intake to prevent bladder urgency. D. Provide a diet high in fiber to promote rapid digestion. Answer B. Administer anti-Parkinson medication promptly on schedule. Rationale: bradykinesia, or slowed movement, is a hallmark symptom of Parkinson's disease. Administering anti-Parkinson medications on schedule can help manage this symptom effectively. While A, C, and D may be important for overall health, they do not directly address bradykinesia. Question 4. The nurse is assessing a patient with Parkinson's disease for cognitive changes. Which assessment finding would be most concerning? A. Difficulty planning and organizing daily activities. B. Occasional forgetfulness of recent events. C. Loss of smell. D. Slight tremor in the dominant hand. Answer A. Difficulty planning and organizing daily activities. Rationale: cognitive changes in Parkinson's disease can include difficulty with executive functions such as planning and organizing. This can signify progression to Parkinson's disease dementia. B, C, and D are symptoms of PD, but are less indicative of cognitive decline. Question 5. A nurse is providing education to a patient with Parkinson's disease and their family. The nurse emphasizes the importance of preventing falls. Which piece of advice is most appropriate? A. Wear shoes with smooth soles to decrease resistance when walking. B. Use assistive devices, such as a walker, for stability. C. Rearrange furniture often to keep pathways interesting. D. Dim lighting in the evenings to reduce glare and shadows. Answer B. Use assistive devices, such as a walker, for stability. Rationale: using assistive devices can provide the necessary support and stability for patients with Parkinson's disease, significantly reducing the risk of falls. A, C, and D may actually increase the risk of falls due to slipping, unfamiliar environments, and inadequate lighting, respectively. Question 6. A patient with Parkinson's disease reports experiencing freezing episodes while walking. What nursing intervention is most appropriate to assist the patient during these episodes? A. Instruct the patient to take larger steps. B. Suggest the patient to march in place before continuing to walk. C. Advise the patient to lean forward to gain momentum. D. Recommend the patient to pause and relax for 5 minutes before attempting to walk again. Answer: B. Suggest the patient to march in place before continuing to walk. Rationale: marching in place can help overcome the freezing phenomenon in Parkinson's disease by providing a rhythm and triggering movement. A and C might increase the risk of falls, and D does not directly help in overcoming the freezing episode. Question 7. A nurse is educating a patient with Parkinson's disease on managing orthostatic hypotension. Which statement by the patient indicates a need for further teaching? A. I will stand up slowly from a sitting or lying position. B. I should increase my salt intake to help elevate my blood pressure. C. Wearing compression stockings can help prevent my blood pressure from dropping. D. I can skip my blood pressure medication if I feel dizzy in the mornings. Answer: D. I can skip my blood pressure medication if I feel dizzy in the mornings. Rationale: skipping blood pressure medication without consulting a healthcare provider can be dangerous. The correct management of orthostatic hypotension involves slow positional changes, possibly adjusting salt intake under medical supervision, and using compression stockings to improve venous return, not altering prescribed medication regimens without advice. Question 8. In evaluating a patient's response to levodopa-carbidopa therapy for Parkinson's disease, which outcome would indicate that the treatment is effective? A. Decreased salivation. B. Increased muscle rigidity. C. Improved voluntary movements. D. Enhanced cognitive function. Answer: C. Improved voluntary movements. Rationale: levodopa-carbidopa therapy aims to reduce Parkinson's disease symptoms by increasing dopamine levels in the brain, thereby improving voluntary movements. While it might be a side effect of treatment, B is a symptom of PD, and D, though desirable, is not the primary target of this therapy. Question 9. A patient with Parkinson's disease is exhibiting signs of depression. Which nursing action is most appropriate to support this patient? A. Limit social interactions to avoid overwhelming the patient. B. Encourage the patient to perform all activities independently to boost self-esteem. C. Recommend participation in a Parkinson's disease support group. D. Suggest increasing doses of anti-Parkinson medications to improve mood. Answer: C. Recommend participation in a Parkinson's disease support group. Rationale: participation in support groups can provide emotional support, reduce feelings of isolation, and improve coping strategies in patients with Parkinson's disease and depression. A and B may actually worsen feelings of isolation and frustration, and D should only be considered under direct medical supervision. Question 10. A patient with Parkinson's disease complains of dry mouth since starting anticholinergic therapy. Which nursing intervention is most appropriate? A. Recommend chewing sugar-free gum or sucking on ice chips. B. Advise the patient to decrease fluid intake to reduce saliva production. C. Suggest the use of an alcohol-based mouthwash for oral hygiene. D. Instruct the patient to take their medication with a large meal to reduce side effects. Answer: A. Recommend chewing sugar-free gum or sucking on ice chips. Rationale: chewing sugar-free gum or sucking on ice chips can stimulate saliva production and alleviate dry mouth, a common side effect of anticholinergic medications. B could lead to dehydration, C could exacerbate dry mouth, and D does not directly address the symptom of dry mouth. Question 11. A nurse is caring for a patient with Parkinson's disease who has been experiencing severe constipation. Which dietary recommendation is most appropriate for this patient? A. Increase intake of high-protein foods. B. Limit the consumption of fibrous fruits and vegetables. C. Encourage the consumption of fluids and high-fiber foods. D. Recommend a strict fluid restriction to manage incontinence. Answer: C. Encourage the consumption of fluids and high-fiber foods. Rationale: constipation is a common issue in Parkinson's disease due to the autonomic nervous system's impairment and reduced physical activity. Increasing fluid and fiber intake can help alleviate constipation. High-protein foods may interfere with the absorption of levodopa, a common medication for PD, and BND can exacerbate constipation. Question 12. When providing care for a patient with Parkinson's disease who is experiencing dyskinesias, what should the nurse monitor for as a potential complication of the medication regimen? A. Bradycardia. B. Hypotension. C. Hallucinations. D. Urinary retention. Answer: C. Hallucinations. Rationale: dyskinesias, involuntary movements, can be a side effect of long-term dopaminergic therapy in Parkinson's disease. Hallucinations can also occur as a complication of these medications, especially in older patients or those with a history of cognitive impairment. The other options are not directly related to the common side effects of dopaminergic medications used in PD. Question 13. A patient with Parkinson's disease reports feeling depressed and isolated. Which intervention is the most effective in addressing these psychosocial concerns? A. An increased dosage of dopaminergic medications. B. Encouraging the patient to engage in regular, moderate exercise. C. Advising the patient to sleep at least 10 hours per night. D. Recommending the patient avoid social situations to reduce stress. Answer: B. Encouraging the patient to engage in regular, moderate exercise. Rationale: regular, moderate exercise has been shown to improve both physical and mental health in patients with Parkinson's disease, reducing symptoms of depression and improving feelings of well-being. Exercise can also enhance social interaction when done in groups. The other options do not directly address the psychosocial aspects of depression and isolation in PD. Question 14. A patient with Parkinson's disease has developed significant difficulties with speech and communication. What strategy should the nurse suggest to improve communication? A. Speaking quickly to reduce the effort needed for speech. B. Using gestures and written communication as supplements to verbal communication. C. Limiting conversations to reduce the frustration associated with speech difficulties. D. Increasing the volume of speech to make words more understandable. Answer: B. Using gestures and written communication as supplements to verbal communication. Rationale: patients with Parkinson's disease may experience dysarthria, making speech difficult to understand. Using gestures and written communication can help improve the clarity of communication. The other options may either exacerbate communication difficulties or reduce the patient's opportunity to communicate effectively. Question 15. For a patient with Parkinson's disease who is at risk for aspiration pneumonia due to dysphagia, which nursing intervention is most appropriate? A. Encouraging the patient to eat larger meals less frequently. B. Assisting the patient in maintaining an upright position during and after meals. C. Advising the patient to drink fluids quickly to wash down solids. D. Recommending the use of a straw for liquid intake. Answer: B. Assisting the patient in maintaining an upright position during and after meals. Rationale: maintaining an upright position during and at least 30 minutes after meals can help prevent aspiration, which is a risk due to dysphagia in Parkinson's disease. The other options may increase the risk of aspiration or are not effective strategies for preventing it. Question 16. A nurse is planning care for a patient with Parkinson's disease who expresses frustration about the increasing difficulty in performing daily activities. What is the most appropriate nursing intervention to support independence? A. Suggesting the patient rely more on family members for assistance. B. Encouraging the use of adaptive devices for dressing, eating, and grooming. C. Advising the patient to perform tasks quickly to reduce fatigue. D. Recommending the patient limit daily activities to conserve energy. Answer: B. Encouraging the use of adaptive devices for dressing, eating, and grooming. Rationale: adaptive devices can help patients with Parkinson's disease maintain their independence by facilitating the performance of daily activities. This approach supports the patient's autonomy and can reduce frustration. The other options may undermine the patient's sense of independence or contribute to increased risk of injury. Question 17. During a follow-up visit, a patient with Parkinson's disease reports experiencing vivid dreams and nightmares. The nurse recognizes these symptoms as most likely related to A. The progression of Parkinson's disease into the advanced stages. B. A common side effect of dopaminergic therapy. C. An unrelated psychiatric condition. D. Dietary factors influencing brain chemistry. Answer: B. A common side effect of dopaminergic therapy. Rationale: vivid dreams and nightmares can be a side effect of dopaminergic therapy used in the treatment of Parkinson's disease. While sleep disturbances can occur as part of PD's progression, the direct link to medication side effects is well documented. The other options are less likely to be directly related to the reported symptoms. Question 18. A nurse is educating a patient with Parkinson's disease on strategies to manage sialorrhea, excessive drooling. Which recommendation is most appropriate? A. Chew gum or suck on hard candy to increase swallowing. B. Apply anticholinergic medication topically to the oral mucosa. C. Decrease overall fluid intake to reduce saliva production. D. Practice facial muscle exercises to improve control. Answer: A. Chew gum or suck on hard candy to increase swallowing. Rationale: chewing gum or sucking on hard candy can stimulate swallowing, which may help manage sialorrhea in Parkinson's disease by reducing the accumulation of saliva. B. May be prescribed in some cases, but is not the first-line recommendation. C. Could lead to dehydration, and D, while beneficial for other reasons, does not directly address sialorrhea. Question 19. For a patient with Parkinson's disease who is experiencing anxiety about their condition, what is the most effective nursing intervention? A. Prescribe anxiolytic medication as needed. B. Offer reassurance about the effectiveness of PD treatments. C. Provide comprehensive education about Parkinson's disease and its management. D. Encourage isolation from stressful situations. Answer: C. Provide comprehensive education about Parkinson's disease and its management. Rationale: education about the disease, its progression, and management options can empower patients and reduce anxiety by alleviating the fear of the unknown. Anxiolytics may be used as part of treatment but do not address the root cause of anxiety. Reassurance and avoiding stress are supportive but do not equip the patient with coping mechanisms as effectively as education does. Question 20. A nurse is planning discharge education for a patient with Parkinson's disease. Which topic is critical to include to prevent common complications associated with the disease? A. Importance of maintaining a sedentary lifestyle to conserve energy. B. Techniques for managing chronic pain associated with PD. C. Strategies to prevent malnutrition and dehydration. D. Instructions for modifying the home environment to prevent falls. Answer: D. Instructions for modifying the home environment to prevent falls. Rationale: falls are a common and serious complication in patients with Parkinson's disease due to mobility issues and postural instability. Educating patients and families on home modifications to prevent falls is critical for safety. While B and C are also important, they do not address the immediate safety concerns related to falls. A is incorrect, as maintaining physical activity is recommended for patients with PD. Question 21. A patient with Parkinson's disease reports off periods where symptoms worsen despite medication. What nursing intervention is best to address this concern? A. Advise the patient to increase the dose of their current medication without consulting the healthcare provider. B. Recommend scheduling a review of the medication regimen with the healthcare provider. C. Suggest the patient discontinue medication during off periods to reset their response. D. Encourage the use of complementary therapies exclusively during off periods. Answer: B. Recommend scheduling a review of the medication regimen with the healthcare provider. Rationale: off periods in Parkinson's disease are times when medication effects wear off and symptoms worsen. Adjusting the medication regimen under the guidance of a healthcare provider can help manage these periods effectively. The other options could lead to unsafe practices or ineffective management of symptoms. Question 22. In teaching a patient with Parkinson's disease about the importance of exercise, which type of exercise should the nurse emphasize as particularly beneficial? A. High-intensity interval training. B. Tai Chi and yoga. C. Long-distance running. D. Heavy weightlifting. Answer: B. Tai Chi and yoga. Rationale: Tai Chi and yoga are beneficial for patients with Parkinson's disease because they focus on balance, flexibility, and strength, helping to improve mobility and reduce the risk of falls. The other options may be too strenuous or not focus enough on balance and coordination, which are particularly important for this patient population. Question 23. A nurse is caring for a patient with Parkinson's disease who is A. Encourage caffeine intake before bedtime to promote alertness. B. Promote a regular sleep schedule and a calming bedtime routine. C. Recommend daytime napping to compensate for lost nighttime sleep. D. Prescribe sleep medication as the first line of treatment. Answer: B. Promote a regular sleep schedule and a calming bedtime routine. Rationale: promoting a regular sleep schedule and a sleep quality in patients with Parkinson's disease. Caffeine intake before bedtime can worsen sleep disturbances, and while naps may be necessary, they should not interfere with nighttime sleep. Sleep medications should be considered carefully and not as the first line of treatment due to potential side effects. Question 24. For a patient with Parkinson's disease who has been experiencing emotional outbursts, what is the most appropriate nursing action? A. Ignore the outbursts to avoid reinforcing the behavior. B. Encourage the expression of feelings in a safe and structured setting. C. Restrict social interactions to reduce stimuli that trigger outbursts. D. Increase doses of anti-Parkinson medications to control mood swings. Answer: B. Encourage the expression of feelings in a safe and structured setting. Rationale: emotional outbursts in Parkinson's disease may be a result of the disease's impact on emotional regulation. Encouraging the expression of feelings in a safe environment can help the patient cope with these changes in a healthy way. The other options may either invalidate the patient's feelings or not address the underlying cause of the emotional outbursts. Question 25. A nurse is developing a care plan for a patient with Parkinson's disease who has difficulty initiating movements. Which intervention is most appropriate to enhance the patient's mobility? A. Encourage complete bed rest to conserve energy. B. Recommend fast-paced aerobic exercises to improve agility. C. Provide support for gradual increased activity tailored to the patient's ability. D. Advise the patient to perform all activities at their fastest possible speed. Answer: C. Provide support for gradual increased activity tailored to the patient's ability. Rationale: gradual increase in